All Hindi team. Good evening, good afternoon, and good morning. This is the 2169th day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Dr. SWATI Makar Kulkarni. Let us begin the session with 1 minute silent prayer. Thank you all. The International Forum for Promoting Homeopathy comprises of homeopathic lovers, students, and doctors. And we have 3 sessions every day. The first session of the day is already over in Hindi from 7:30 to 8:30. From 8:30 to 9:30, we have a local language session in Malayalam. And from, as you all know, we are uploading the videos of the same on the very next day itself, so that those who missed the session can watch it again. You can subscribe the same without paying any money. The purpose of this forum is to take homeopathy to every home around the world. And today, our guest is Dr. SWATI Makar Kulkarni. And Dr. has completed MD and is the professor, practice of medicine, late Mrs. Ausbai of Homeopathic Medical College, Maharashtra. She is the consultant homeopathy clinic, Sangli, Maharashtra. And today, Doctor will be talking about schizophrenia, 100 to reality with homeopathy as complementary. We have discussed different subjects every day, and this is one of the very good subject because schizophrenia is a very fine subject to be discussed. Let us see what Dr. SWATI Kulkarni has to say about this. Welcome, madam.
Thank you, sir. Good evening, all. And I hope the screen is visible and I'm audible to everyone.
No, you have not shared. Please, I will make you co-host, and then only you will be able to share the screen. Please wait. Okay, now you are co-host and you can do it.
So is this visible?
No, you may stop screen sharing and then restart. You can adjust your camera a little more. Only half the face is visible now. Please adjust your camera a little more.
Okay, I hope the screen is visible to now, everyone.
Yes, fine. You can go ahead.
So hello everyone once again, and let us begin with my topic, that is schizophrenia. The schizophrenia is titled as Unreal to Reality with Homeopathy as a Complementary. Let us take this half part of the title little beside, and let us talk first about this unreal to reality. As the diagram represents, the schizophrenia has occupied the entire brain, and which is full of everything, like there is delusions, there is thought process disturbances, there is depression, there are mental disorders and everything. There are paranoid symptoms, there are certain emotional symptoms, and genetics is behind and everything. So the picture itself represents that schizophrenia is a hydra-headed disease which has a very complex presentation, and it is little difficult to treat and rather more difficult to understand. So this is my little effort to make this is simplified. Let us hope I will be successful in doing so. So before going to the disease proper, begin with the saying, if you talk to God, you are praying, and if God talks to you, you have schizophrenia. Now, what is the meaning behind these two lines? So, reading between these two lines, let us understand the disease with the interview with a patient. Now, a patient who is having some mental disturbances or who is having some abnormal or bizarre behavior is brought to you. You are a doctor, and mental disorder patients are brought to you in two ways. Either the patient will come by himself to a car to consult you. These patients are called as neurotic patients because they are having insight for the disease present. They know there is something wrong with their psychology. And another group is called as psychotic disease, where the patient doesn't know that he is having something wrong with his behavior or with his thought process. And the patient always thinks that he's absolutely right. But the friends and family finds that there is something abnormal behavior, and then this patient is brought to the psychiatrist or a physician. So you're a physician, a patient is brought to you. Obviously, to begin with the interview, you will first ask the patient, what's your name? Now, to this question, the expected answer will be something like ABC or XYZ. Instead, the patient here is answering that I am Lord Krishna. Now, this is not the answer which is expected. Still, you go on continuing with the interview and you ask the next question about the address, that where do you stay. Now, to this, the expected answer is obviously someplace in a town or in a city or a state or a nation or somewhere on the earth. Rather, you are getting the answer like I stay everywhere, sometimes in the air, sometimes on the earth, and sometimes in the water. Now, the interview goes on like this, and finally, you come to the conclusion that this is an example of irrelevant talk. Simultaneously, you are asking for 1,000 times that, to the patient that please sit properly in the chair or please lie on the bed, but the patient will not listen to your commands, and rather he will try to stand in a position which has been shown in the picture, like Lord Krishna. He will be standing with the hands holding a stick like as if he is playing a basuri, and then he will try to mimic the posture in the picture. So this, we again confirm that there is bizarre behavior and with the irrelevant talk. We will label the case as schizophrenia. No doubt that everything is wrong, the talk is irrelevant, the behavior is abnormal. But why this abnormal behavior? So the reason behind every schizophrenia is a delusion. The delusion will vary with every patient. Not a fixed delusion will be present for every patient, but there is always a delusion behind patient's abnormal behavior and his abnormal thought process. In this interview, the delusion the patient is having is that he is Lord Krishna. Now, if you ask the patient why you are Lord Krishna, the answer will be Krishna was Hindu, I am Hindu, so I am Lord Krishna. We call it as law of association. Now, if we apply this law of association to the entire community, the whole population will be the god or goddesses of their own community, and then this will be having no meaning. So then we call it as irrelevant. But here the patient has this fixed belief that he is Lord Krishna. Now, if you now again go through the interview from the patient's viewpoint, we will find the relevance. Like we are asking his name, he is answering, I am Lord Krishna. And since childhood, we are being taught that God is everywhere, God is in the air, God is in the water, God is everywhere on the earth. So you are asking about the address to Lord Krishna, and definitely he will answer likewise. He has never seen Krishna lying on the bed or Krishna sitting in a chair. So definitely, even though you are asking him to sit in the chair, he is not going to obey you. So this is what is the base of schizophrenia. I hope the basic concept is clear, and let's move ahead to the definition. Now, what is schizophrenia? It is a complex chronic mental health disorder characterized by an array of symptoms, including delusions, hallucinations, disorganized speech or behavior, and impaired cognitive ability. The definition itself is very complex as like the disease. So this is definitely a chronic disease. There are variety of symptoms. Most of them are representing disturbed cognitive, and then there will be disturbed emotional aspect and disturbed motor behavior. It affects approximately 1 in 300 people worldwide and can significantly impair daily functioning and quality of life. The disorder is characterized by a range of symptoms that can vary in severity and duration. Earlier, the schizophrenia was used to call as dementia precox. Now, why this name dementia precox? Dementia is deterioration of mind and precox is youthful. So, simple meaning of this word, of these two words was youthful insanity. As most of the cases of schizophrenia are seen in puberty or in early adult life, the name given to this disease earlier was dementia precox. Later on in 18th century, Bleuler gave this terminology as schizophrenia. Now, what this terminology means? The word schizophrenia means split mind. By listening the split mind, there is always a myth that schizophrenia means split personality, but which is entirely different from the schizophrenia. The split mind or splitting of the mind has been labeled to this disease because it simply means disruptions or fractures in how a person thinks, how he feels, and how he perceives reality when the symptoms of the disease are active. So the word schizophrenia means splitting of the mind, but that is the patient is not able to distinguish the real from unreal. Now let us go to the epidemiology of the disease. Though the disease is rare, it is not that rare as we think. There are 2.5 million Americans who suffer from schizophrenia. About 1% of the population has schizophrenia. Neither the doctors nor scientists can accurately predict who will get the disease. So the cause is largely unknown, although the disease almost surely arises from the neurons that take a wrong turn during fetal development. It strikes most of the people right before adulthood. So this is a brief introduction about the disease. Now, there is a very popular myth about schizophrenia, so let's get it cleared first. People always think schizophrenia is a split personality or multiple personality disorder, but it is absolutely different. It is a chronic disorder of the brain which has many symptoms like delusion, hallucinations, and thought processes. In short, if we try to understand schizophrenia, it is a mental disorder that often leads to distorted thoughts, hallucinations, and delusion. He or she will also have a lack of motivation and can become violent easily. A person who has schizophrenia often goes through extreme levels of anxiety and stress. Early symptoms include trouble concentrating, temper flares, difficulty in sleeping, and extreme anxiety. It's a mental disorder that makes confusion and illusion in patients' brain. Now, this was in short, brief introduction about the schizophrenia. It is once again, I will repeat, it's a serious mental health disorder that affects thinking, emotions, perceptions, behavior, and reality interpretation. Now, before going to the symptomatology of the schizophrenia, I would like to introduce in front of you the popular trilogy of the mind, or three important aspects of our psychology. Now, this trilogy of the mind represents three parts. The upper part or most important part is cognition or cognitive, which includes all our intellectual functions. Like it includes memory, it includes understanding, that is perception, it includes thinking, it includes creativity, and everything which needs intellect to do. Of course, another part of the psychology is dealing with the emotional aspect, that is called as affect or affective part of the psychology, which is including all emotions, feelings, and mood. And then there is third aspect of the psychology, which is known as conation. Conation is purposeful movements or motor behavior or intentional movements of the body, which are obviously carried out by the cognitive orders and which are always representing our emotions. So conation will be reflecting cognition, will be also reflecting our emotional part. So cognition, conation, and affection form the classic trilogy of the mind, which represent the three distinct functional divisions of the human consciousness: thinking, feeling, and doing. Of course, there is always a correlation between these three. We think, we feel, and then we do. So when we say it's a human behavior, that is always a combination of these three. Now, how schizophrenia is different from other diseases? Say, for example, there is a disease which entirely represents the affective disorder or disorder of affect, that is depression or mania, which has prominently mood disorder, but there the cognitive is remained intact and motor behavior too partly is remained intact. If we say the disorders of conation, it is not going to affect the intellect, neither it is going to affect our emotions. But that is not the case with schizophrenia. It is a major cognitive disorder. It is a major psychotic disorder where cognition on its whole is been disturbed. And when the cognition, that is thought process or perception, is been disturbed, that is definitely going to hamper our emotional aspect and definitely going to disturb our conation part. That's why we call schizophrenia as heteroheaded, because we can get a variety of symptoms in the disease. If we study the 10 cases of schizophrenia, every patient will be reflecting different features. There will be nothing common for them. One patient will be having mood disorders, disturbed mood and everything. Another will be having major disorders with conation, that is catatonic schizophrenia, whereas one will be in the disorganized schizophrenia where disturbed thinking will be a marked feature. So moving ahead with this brief introduction to the cognition, conation, and affect, we'll go to the four fundamental A's of schizophrenia. In short, we can say about schizophrenia are the four A's of schizophrenia. First of which is ambivalence. The word meaning of ambivalence is inability to decide whether for or against. That simply means we have lost our reasoning capacity, because reasoning is the power given to us which always makes us firm about whether we are for a thing or whether we are against for a thing. Second is autism. We always listen to the society and we always follow the rules of society, and that's why we are considered as normal. That is not the case with schizo. The patient is having autistic behavior, he is in autism, so he is withdrawal into self and he is having his own rules. There are always private and illogical rules for his behavior. The rules are no way connected to the environment. The rules are made by him and for him, and they are not concerned to the society anymore. Third A is affect disturbances. Disturbances of affect means emotional disturbances. Obviously, we have seen earlier when the cognitive is disturbed, the emotions will be obviously inappropriate to the situation, and hence we call there are affective disturbances in schizo. Last are association disturbances, like loosening of associations or thought disorder. Now, why association disturbances? As I said earlier, when the cognitive or thinking process is disturbed, obviously our emotions are not going to be appropriate, neither our motor behavior will be appropriate. So there will be different thought process disturbances which are going to block ourselves when we are speaking, or we'll have repetition of our speech and everything, which we'll be seeing further in the next slide. Now, the first and most important predominant feature or clinical feature of schizophrenia, that is delusion. We can say the key feature of schizophrenia is delusion. It is always said that schizophrenia is difficult to treat. That is because we are not able to remove delusion or to rule out delusion by any explanation or any reasoning to the patient of schizophrenia. There are two types of delusions, primary and secondary delusion. We all are normal people and having a variety of secondary delusions. Like every one of us has a lucky pen, lucky shirt, lucky color, lucky day, etc. Now, why this lucky? Because that is based on some past experience. That lucky might have been proven or might have given us some pleasurable moments in the earlier life, and hence we consider it as lucky. And contrary, we can have some unlucky things too. So all these delusions are secondary delusions because they are harmless and they are based on some past experiences and we can explain them. The delusions in schizo are always primary delusions which has no explanation, no logical reasoning power, and these delusions are key feature of schizo. There are variety of delusions. Every schizophrenic patient will be having a different delusion, but let us categorize some common delusions of schizo and let us discuss this. Among these, first and important delusions are persecutory delusions. In persecutory delusion, patient believes that either a person, maybe his friend or family member, or a group where the person is working, or any organization where he is working, is plotting against. Everyone or the world is against him. The people are harassing him without a reason, or people are trying to harm him. People are going to poison him. These kind of delusions are known as persecutory delusions. They are marked features in paranoid schizophrenia. Sometimes we may come across the grandiose delusions in a patient. The grandiosity delusion or grandiose delusion means the patient believes that he possesses some exceptional fame, immense power, or unique divine abilities. We can take example of a sulfur which is showing grandiose delusion. Obviously, the sulfur is not the remedy for schizophrenia, but just to explain the grandiose delusion, I would like to give the reference of sulfur. Sulfur is not an imbecile patient like Barata. Sulfur is an intelligent fellow. Still, we have the keynote in sulfur that sulfur wears a paper crown and thinks it's a diamond crown. Now, when the sulfur is an intellectual fellow, why he will wear a paper crown and why he will wear dirty clothes and come to a party? The reason behind this is sulfur always has this grandiosity delusion. The paper crown is of paper crown when it is on someone else's head. And when the same crown is on his head, that becomes the diamond crown because now it belongs to him. So he is that great that even though the dirty shirt he is wearing will be of a very valuable thing because now it is his shirt. So this is a grandiosity delusion. The person always thinks that he is someone great, he is some great personality or with some immense power. Third delusion we may come across is delusion of reference or referential delusion. The person believes that neutral or everyday events or public actions, they always carry direct or personal meanings for you. Say, for example, a girl is crossing the street and two boys are behind her. That is a simple day-to-day activity that girl is going to a college or girl is going to catch a bus and the boys too are also going to catch the same bus. The girl always feels that they are following her. and then she will increase the speed. The boys may feel that the bus may that they might be late, so they will also increase the speed, and here the girl always thinks ki now they are following her. So this is what is delusion of reference. All neutral things or all public actions are not related. They are not related at all to the patient, but patient will relate all these actions to himself. Sometimes we come across a delusion of control. Delusion of control is believing an external force or electronic device is manipulating your thoughts or actions. Here, the patient thinks that whatever thoughts are there in his brain are not his. They are not originated in his brain. Rather, they are put into his brain by some other supernatural power. It may be a god, it may be a demon, or whatever. Let us take the example of one very famous Hindi movie, Lage Raho Munna Bhai. In that, the hero is so much obsessed with the hallucination that he sees Bapu everywhere and he listens to him. And every time when the hero is in some difficult situation, he always takes help of Bapu or he always calls him. Then the Bapu will appear in front of him. He will give him the answer. The answer itself is actually given by his brain or by his thought process, but the patient himself here is under this delusion of control. So he will think that this answer is not mine. It has been given by Bapu, and hence this is a delusion of control. Lastly, we can come across sometimes the somatic delusions which are related to the body. The somatic delusion is they are usually related to own body part, like the body part, some body part or some of the part of the limb is missing or it has been distorted. I may have some cruel face, etc. So these are a few examples of delusions. Of course, the list is never ending because every patient will be having a different variety of delusion. So again, this is a diagrammatic representation of some common delusions in schizophrenia. First shows persecutory delusions, grandiose delusions, referential delusions, erotomanic delusions. By this, we mean the patient always thinks that some rich famous personality or some world famous personality is deeply in love with the patient. He may be the boss, he may be the national crush or whatever, but this famous personality is deeply in love with the patient. And then somatic delusions and nihilistic delusions. Nihilistic delusions are totally negative delusions which are having very poor prognosis in schizo cases. Nihilistic delusions always represent that everything is going to an end, like the world is coming to an end, or he himself is coming to an end. He is no more going to exist, or some body part is being destroyed, etc. These are few examples of nihilistic delusions. The second predominant feature of schizophrenia is hallucinations. After delusions, definitely the patient is going to have developed hallucinations. Hallucinations are of all varieties are common, like auditory, visual, tactile, or olfactory, but most common will be auditory hallucinations. Auditory hallucination may involve two or more voices arguing. Like in anacardium, we get the keynote feature that in one ear the angel speaks and in another ear the devil speaks. This is like two or more voices are arguing. There may be auditory hallucination like running commentary of one's actions and thought. Whatever he is doing, the voice comes into his ear and the voice comments that whether he has done right or whether he has done wrong. There can be auditory hallucination of constant criticism. Here we can take the example of another Hindi movie like Kartik Calling Kartik, where the patient always gets auditory hallucination throughout the movie. He wants to be a superior Kartik, whereas he is very shy fellow, and then the superior Kartik always gives him auditory hallucination, and then he is able to, and then he follows all his commands. Among the auditory hallucinations, most dangerous are giving instructions that must be obeyed. Sometimes that may be suicidal or sometimes that may be homicidal too. Hence, they are considered as most dangerous. Actually, the risk of suicide is very low in schizophrenia. It is very common in depression. But still, the suicides are common in schizophrenia because of this auditory hallucination. Some supernatural power or some god or some demon speaks into his ear and says ki jump, and the patient will jump from 10th floor, 11th floor or whatever. And then we consider this as suicide. Actually, these are auditory hallucinations which are there for the patient, and he is simply following all these instructions given to him. Next common are visual hallucination, which often involve distortions of body or environment. There are variety of visual hallucinations as per the patient's delusion. Tactile hallucination may accompany the somatic delusions, like something is crawling under my skin, there are ants on my skin, or some of my body parts are made up of wood or limb, which we see in Thuja, that the limb is made up of wood, etc. Olfactory hallucination, very rare, like one is emitting a foul odor. Then the third predominant feature of schizophrenia. This is thought disorder. Let us consider the thought and speech disorders in combination, because what the person thinks is always reflected to the society through his speech. So the thought process is grossly disturbed. So we call it as delusional thinking. Delusional thoughts are often extreme and interfere with a person's daily life. Now, what does delusional thoughts will make the person do? The person represents with a variety of speech disorder. Like there is one feature known as neologism. The neologism is a feature where the patient does not use the routine terminology. Like he may call the stomach as food vessel. Now, logically thinking, the stomach is a vessel which contains food, but we do not call the stomach as food vessel. So the patient is using terms which are not in the dictionary. Which we are not conventionally using this terminology as food vessel. We call it as stomach, but the patient will use this word. So such type of feature is called as neologism. Sometimes there may be feature like echolalia. Echolalia is person repeats the questioner's question, or whatever the persons are speaking around him, he will repeat the same sentences again and again. That is echolalia. Echolalia. If you ask the patient, what's your name? Instead of answering, he will say, what's your name? Like we sometimes see in the babies, but that is too normal. Then there can be clanging. Clanging is rhyming words together. Patient will connect the words which are having the same rhyming rather than looking at its meaning. For example, he may say, "I tied a rope soap nope." So this rope soap and nope has no connection at all with themselves. Yet the patient is speaking like this because it has the same rhyming. Another feature is alogia. Alogia is a grossly negative phenomenon. In alogia, the patient is in the stage of absolute mutism. You ask hundreds of questions to the patient. He is not going to answer at all, or he will simply answer in yes or no. This is alogia. Sometimes there is thought blocking. Blocking is the patient is speaking and suddenly he stops in the midst of his answer. He pauses and then he again begins with some new topic. The topic where he was paused has been lost forever. It was blocked and the patient has started talking on some new subject. Then there can be disorganized thinking. In disorganized thinking, this is the most common symptom of schizophrenia. Patient jumps from one topic to another, making conversations hard to follow, and they may be off the topic. So there are varieties of thought disorder. So three prominent features of schizo will be: first will be obviously delusion, second will be hallucination, and third will be thought disorder. In total, if we classify the symptoms of schizophrenia, we have some symptoms which we consider as positive. In that comes hallucinations, delusions, disorganized speech, and bizarre behavior. Negative symptoms: blunted affect, poverty of thought, that is alogia or mutism, loss of motivation, that is avolition, inability to experience pleasure or joy, that is anhedonia. The patient has absolutely lost his capacity to experience pleasure from anything. He is doing the things, but there is no pleasure. Then there are cognitive symptoms like inattention, easily distracted, impaired memory, poor problem solving skills, poor decision making skills, illogical thinking, and impaired judgment. All these symptoms belongs to cognitive. They are disturbed reasoning, disturbed thinking process, and disturbed perception. Then there are some co-occurring problems like anxiety, depression, etc., which are disorders of the affect or emotional part. And with this, there are disorders of behavior, that is phonation also. Patient may have abnormal motor behavior like excitement, dancing, singing, or there will be very depressed body movement, like patient may not move at all. So what these all symptoms are going to do? Definitely, all these symptoms are going to alter the individual's ability to work, interpersonal relationships, self-care abilities, social functioning, and quality of life. So that is what is symptomatology of schizophrenia. Here, once again, we differentiate the symptoms into positive, negative, and cognitive symptoms. It will be repetition, so we'll just skip this slide. This is a diagrammatic representation of positive symptoms, negative symptoms, and cognitive symptoms. So hallucinations, delusion, disorganized, anhedonia, evolution, blunted affect are negative. Memory issues, inability to process, and impaired sensory perception is cognitive symptom. Now, why this classification positive and negative symptoms? This is dependent on the patient's prognosis. So later on, we will be going to the prognostic criteria for schizophrenia. So while looking for the prognostic criteria, when the patient is having hallucinations, delusions, or disorganized speech, the patient is having better prognosis. Whereas when the patient comes with symptoms like anhedonia, convolution, or blunted affect or flat affect, the patient has bad prognosis. That's why this differentiation has been made. Okay, so now let's get to the etiology of schizophrenia. It is not yet been proven that what exactly causes schizophrenia. So we'll take in combination all four factors. The first and of course most important part will be genetics. Schizophrenia sometimes runs in the families. However, it is important to know that just because someone in a family has schizophrenia, it does not mean that all other members of the family will have it as well. This has been studied with some identical twins. If one of the baby is brought up in some normal family environment and another baby is brought up in the family with a schizophrenic parents, then the baby which is brought up with the schizophrenic parents has high chances or has developed later on in schizophrenia. Whereas the baby which is brought up in a normal environment had very less chances or never developed schizophrenia. So though there is role of genetics, it definitely depends on bringing up or other environment of the child. Then the role of environment. Many environmental factors may be involved, such as living in poverty, stressful surroundings, and exposure to viruses or nutritional problems before birth. All these environmental factors are the factors during prenatal or antenatal environment. So, if the mother is exposed to certain viruses, mother has carried her pregnancy throughout in some stressful surrounding or some stressful environment. The mother was lacking some nutrition. That may be another feature which may add up in causation of schizophrenia. This will lead to chemical imbalance in the brain, and this will be added like substance use or substance abuse. If the mother is alcoholic, then there are high chances that the baby may develop schizophrenia, or in adulthood or early puberty, if there is substance use or substance abuse, again, the patient may have genetic predisposition and he is with substance abuse. There are high chances that he will develop schizophrenia in the later life. So in total, if we put a path to schizophrenia, this is the diagram which explains the etiology. There are early causes, all these are prenatal causes, genetic, obstetric complications, etc., which we have already discussed. So this will make the person vulnerable for the disease, and then this will be like adding fuel to the fire, that is abuse of certain drugs, social stress or isolation. This will result into neurocognitive impairment, social anxiety and isolation, odd ideas, and in total, this will lead to psychosis. Psychosis, obviously, schizophrenia is a major psychotic disorder. So thus we can say there is genetic predisposition plus environmental, social, and psychological factors. Both the factors will lead to neurodevelopmental abnormalities and target features, and then this will lead to brain dysfunction, improper balance of chemicals. Ultimately, it is going to lead to schizophrenia. After the etiology, let us consider the different varieties of schizophrenia. Some modern medicine now recognizes that schizophrenia has no specific type. Still, we can categorize certain schizophrenia into certain types. Among these, 5 are the common types of schizophrenia: paranoid, disorganized, catatonic, undifferentiated, and residual schizophrenia. So, what is paranoid schizophrenia? Meaning of the word paranoia is suspicion. The paranoid schizophrenic patient will be having marked persecutory delusions. Always he is thinking that something is wrong with his family and the family is plotting against him. If he is working in an organization, they are making plans against him. Usually these paranoid or persecutory delusions are towards their partner. They always feel that the partner is not faithful, and then there will be marked paranoid schizophrenia features or persecutory delusions. So there will be hallucinations and delusions, mostly persecutory, few negative symptoms, little cognitive impairment. Residual schizophrenia, it is considered as the recovery phase of schizophrenia. As we said in the definition, it's a chronic disease. So it begins usually in the puberty or in early adulthood. It has some acute attacks. Later on, the patient has some asymptomatic phase or phase of latency. Again, there is exposure to certain stress. That stress may be internal, may be environmental, and the patient again has the acute attacks of schizophrenia. So the disease always runs a chronic course. And when the patient is in the phase of recovery, we call this phase as residual schizophrenia. So there may be negative symptoms. The patient is very shy, patient is having a no initiative or having all negative symptoms, no positive symptoms, and no marked or excitatory features. Third is known as disorganized. Earlier it was called as hebephrenic schizophrenia too. Disorganized schizophrenia has predominantly thought disturbances. So there will be illogical thinking, speech, and behavior. And then no catatonia, usually no marked disturbances of affect, no marked disturbances of body movements, that is phonation, but there are marked disturbances with the cognitive. Catatonic schizophrenia is a variety which may come into two types. Dominant symptom is catatonia. Catatonia is body movement. So catatonic schizophrenia will be presenting either with the excited body movements. So this is known as excitatory catatonia, or there will be another feature where there are no body movements at all. That is called as stuporous catatonia. Among the stuporous catatonia, there is a feature sometimes the patient may develop, which is known as waxy flexibility. So what does waxy flexibility means? The patient is not moving at all. He may be lying still for 7 to 8 hours. Simply his eye movements are there, his respiration is going on. We can say the patient is alive. Otherwise, you ask him hundreds of questions, he's not going to answer. So he will show the feature like alogia or mutism. He will do no body movements at all, as if he is made up of a wax statue. Hence, the word is used as waxy flexibility. So the catatonic schizophrenia can come into two ways, maybe excited or very vigorous body movements. The person may be in dancing phase, known as excitatory, and another feature where the person is showing no movements at all, known as stuporous catatonia. Lastly, it is undifferentiated. When we are having the symptoms of schizophrenia, maybe two of the following, like delusions, hallucinations, illogical speech, illogical or catatonic behavior, negative symptoms. So any two of the following symptoms are seen. The symptoms are meeting criteria for other, they are not meeting criteria to classify them into other types. And then we classify this schizophrenia into undifferentiated. Simply when we cannot classify into above 4 types, we will call this schizophrenia as undifferentiated one. Next part is how you're going to diagnose the case. Of course, there are 3 stages to diagnose this case. First and most important will be mental health examination. This is a major psychotic disorder. There will be no insight for the disease, and patient will show grossly disturbed psychological behavior. So we'll do mental health examination in total, and then we'll do the physical health examination. Now, why physical health examination? This is because we always need to rule out certain physical diseases or certain biochemical abnormalities which may be responsible for such type of delusions or such type of abnormal behavior. So to rule out, we'll do physical health examination to rule out any neurological abnormalities. And lastly, we do all lab tests and screenings. So these are diagnostic criteria for schizophrenia. A, most important, identify the characteristic symptoms. Patient must have at least 2 of them: delusions, hallucinations, disorganized speech and thinking, abnormal motor behavior, and negative symptoms. Now consider patient's life with others. So it is not necessary, it is always to take the information from the patient's friends and relatives, especially when it is a case of neurosis. The patient himself will give you all the history. But for psychosis, it is exactly opposite. You always need to gather information from the patient's accompanying. There may be friends, there may be family, or there may be colleagues, which will give us the references of his abnormal behavior. So always consider patient's life with the others, at the place of work, at the place of academics, his interpersonal relationships, and his self-care. Most of the times, when the patient is having some mental disturbance, obviously the self-care will not be taken much. Self-care will be disordered. See how long the symptoms have been appearing. There should be persistence of the symptoms for at least 6 months to diagnose the case of schizophrenia. If the symptoms are there but not lasting for 6 months, less than 6 months, we call it as acute schizophrenic disorder. D is rule out other possible culprit illnesses. As we said earlier, there are certain physical illnesses which we are going to discuss in the later slide, which may be responsible for such type of abnormal things, abnormal behavior like delusion, etc., or sometimes hallucinations too. So rule out all possible physical illnesses. And then rule out substance abuse, because there are certain narcotic poisoning cases which may have this delusion and schizophrenia disorder. So, how to diagnose schizophrenia? There are currently no medical tests to diagnose schizophrenia. In many cases, a family member or close friend notices the unusual or bizarre symptoms and initiates an evaluation. So, it is not the patient himself is going to appear, it is the friend or family who is going to bring the patient to you. Lab tests, drug screening, and all X-rays are usually done to first rule out the potential causes of unusual symptoms. To diagnose schizophrenia, psychiatric assessments are done. This includes interviewing and observing the patient and obtaining additional information from family members, others who know the patient, and or of past treatment providers and psychiatric records. However, signs of this disorder must be present for at least 6 months to be diagnosed. If it is less than 6 months, it may be diagnosed as schizophrenia disorder or brief psychotic disorder. After diagnosis comes the part of prognosis. So, what are the good prognostic factors and what are the poor prognostic factors for schizophrenia? If the patient is come to you and it is the first episode of schizophrenia indicating abrupt or acute onset, always a good prognosis. If the patient is having insidious onset, always a poor prognostic factor. Later onset will be always good prognostic. If the disease is occurring or the first symptom of schizophrenia has been seen at the younger age, there is always a poor prognosis, because definitely they are going to have some remissions, frequent attacks, and the disease process will be chronic. Whereas if the first attack of schizophrenia is at a later age, maybe after 35, maybe at the 40, it is considered as good prognostic factors. That is because the patient is always been very mature one, he is having responsibility of the family and everyone, and that's why the prognosis will be better. If the presence of precipitating factors are there, that is considered as good prognosis, because when we remove this precipitating factor, there are high chances that patient will be improved. Whereas if there is no precipitating factors and yet the patient is getting schizophrenia attack, then it will be a poor prognostic factor. The patient was having good premorbid personality. By meaning of this good premorbid personality, the patient was very happy-go-lucky, or patient was having good interpersonal relationship with his friends or family, then he is considered to be of good premorbid personality, always good prognostic factor. Poor premorbid personality, where the patient's nature was very shy, aloof, he was very introvert kind of person, having no friends or single friend, etc., no sharing, etc. This is considered as poor premorbid personality. If there are paranoid or catatonic subtypes, they are good prognostic factors. Simple undifferentiated subtypes, bad prognostic factors. Duration less than 6 months, good one. Duration more than 2 years, bad one. Predominance of positive symptoms, good factor. Predominance of negative symptoms, bad prognostic factor. Family history of mood disorder, good one. But if there is family history of schizophrenia, that is bad one, which we have already discussed in the etiology, that there is always a genetic predominance for this disease to occur. Good social support will always lead to good prognosis factor, not only for schizo, but for every other disease. And poor social support will be a poor one. The disease occurring in female, it's good prognostic factors. Females are otherwise sturdy and they are always warriors. So they will definitely overcome the schizophrenia too. Whereas if you are male and having schizophrenia, it will be poor prognosis. If you are married, the good prognosis. If you are single, divorced or widow, that is bad prognosis. That is because you don't have emotional support. Outpatient department, that means you have not a single time you are being admitted for schizophrenia treatment. It is good one. Whereas when you are hospitalized or admitted, maybe for ECT or any other therapy, it is considered as bad prognostic factor. Now, there are varieties of differential diagnosis for schizophrenia, but as the time is lacking, we'll consider only two major or which may be commonly misdiagnosed with schizophrenia. So first one is split personality. Now, what is the difference between split personality? So let us do not call the split personality as split personality. We'll call it as dissociative identity disorder or multiple personality disorder. So the key feature of schizo will be loss of contact with the reality, that is psychosis. The key feature of dissociative identity will be presence of two or more distinct identities. Symptoms of schizo will be hallucinations, delusions, disorganized thinking, emotional flattening, and social withdrawal. Whereas in multiple personality, there is sudden identity shift, memory gaps, that is amnesia for the previous personality. Different names, voices, personalities taking control at different times. In reality orientation, the schizophrenia reality orientation is definitely impaired. That's why the title is unreal to real. That is always impaired, and person may be confused about the time, place, and person. Whereas in dissociative identity disorder, this reality orientation is intact, but when the person is in one identity at the time. So this is the little differentiation between split personality and schizophrenia. So a take-home message: do not confuse or do not misdiagnose the case as split personality when it is a case of schizophrenia. Now there is another disease which may mimic like schizophrenia, that is Alzheimer's disease and schizo. Alzheimer's may have delusions, but grossly they are persecutory, theft, and infidelity. Whereas schizo has delusions which are persecutory and thought control. Hallucinations, Alzheimer's has visual hallucinations more common, whereas schizo has auditory hallucinations more common. Presentation, flat affect, evolution, apathy, poverty of speech, and thought will be seen in Alzheimer. That is, what we consider all negative symptoms of schizo will always be present in Alzheimer's. And in schizo, there can be variety of symptoms or array of symptoms, including all these negative as well as positive symptoms. Family history of Alzheimer's disease, here family history of major mental illness, and then progressive decline with aging, because Alzheimer is a disease of aging. It will be never seen at young age, contrary to the very popular movie in the last year. But Alzheimer is usually the disease of the old age. As we grow, we are more prone to get Alzheimer. Whereas schizo is a youthful insanity. It is going to appear during early puberty or in early adult life. So it has fluctuation, but usually there is gross age difference between Alzheimer's and schizo. Treatment option. Obviously, these are different ways to treat schizophrenia. Now, there is no fixed variety to treat no fixed treatment option for the schizo, because there are variety of symptoms for every schizophrenic patient. Like some patient may be excited, some patient may be very aggressive, and may have some homicidal attempts or suicidal attempts. For these patients, we have no other choice than giving them ECT, that is electroconvulsive therapy. Whereas one patient may be in maxi flexibility, alogia, absolute mutism, he is not doing any movements at all. He will not lead electroconvulsive therapy, rather it is going to ruin them. So they will need some counseling or individual therapy. Patient may need hospitalization as per the case. There are certain lifestyle changes, like if the person is living with some pro-social environment, like not with living or not sharing his apartment, etc., then we may advise the patient to have some friends or have some flatmates, so that he will be having some emotional bonds with the other person. There is always family therapy needed for the schizophrenic patient. There is individual therapy, but the family therapy is always needed, because they are the people who will be accompanying him all the time and tolerating all his abnormal behavior, and they are the people who are going to correct it. So we always need to teach the family how to behave with the patient with schizophrenia. Then there is vocational rehabilitation depending on the case, social skills training, and obviously first and most important is antipsychotic medication. Now, I'm not the right fellow to comment on, because we will be speaking on the homeopathic treatment. So, last part of this topic is schizophrenia treatment in homeopathy, a holistic approach to managing symptoms. Homeopathic medicines are long-acting therapies that try to address the underlying causes of schizophrenia in order to achieve a miraculous recovery. Natural homeopathic medications can help with many types of delusions, hallucinations, and other symptoms of schizophrenia. With the use of these medications, the severity of the symptoms is gradually reduced and a sense of general well-being is restored. So, mind well, we never claim that we are going to cure the schizophrenia. It is always said that these are long-acting therapies, and we are going to make him better, and he's making his life better. So, what are certain common homeopathic remedies? First is lachesis, often recommended for patients who are experiencing extreme suspicion, delusions of being poisoned, or feeling of being controlled by superhuman power. It helps to reduce the intensity of symptoms and promotes well-being. Second will be hyoscyamus, used for paranoia and inappropriate behavior. The remedy is effective for patients who exhibit jealousy and impulsive tendencies. Stramonium is a third remedy which is beneficial for the patients with severe phobias and hallucinations, particularly those who are experiencing intense fear and agitation. Anagardium, as we said earlier, it is useful remedy with marked amnesia and disorientation, as well as auditory hallucinations and inner conflict. Arsenic used for anxiety and paranoia, providing comfort to the individuals who feel restless or excessively worried about their safety. Among the delusions, as we said, schizophrenia is nothing but a delusion. Because why the schizophrenia is difficult to treat? Because it is difficult to treat his delusion. So homeopathic approach will be obviously to remove this delusion or to try to remove this delusion. So we can try certain remedies depending on the patient's delusion. Among these are stramonium, belladonna, hyoscyamus, which are given for persecutory delusions. The belladonna will be having suspicions, violent delusions. Hyoscyamus will be having fear of poisoning. Grandiose delusion, that is belief of extragated power, wealth, or identity. Among these are platina, lachesis, veratrum, hyoscyamus, and natrum mood. Platina, known for its pride and superiority complex. Lachesis, dominant prophetic delusions, that is related to the religious feelings. Veratrum, again for religious delusion, belief that the partner is unfaithful. Hyoscyamus, jealousy with suspicion, and here lachesis is also with jealousy, but jealousy with loquacity. If the jealousy is with suspicion, go for hyoscyamus. If it is with loquacity, go for lachesis. Natramur is very sensitive one, yet he is jealous and he is dwelling on the betrayal, and hence the schizo. Erotomanic delusions, believe that someone, often important, is in love with them. For this, there are two medicines, platina, where there is erotic pride. Always thinks she is Miss World or Miss Universe, and then everybody or the whole world is in love with her. Whereas pulsatilla is always dwelling on some romantic imagination. Somatic delusion, false belief regarding bodily functions or disease. Thuja, fixed ideas about body, sensation of warmth. Cilicia, delusions of structural illness, chronic infection sensations. Nihilistic delusion, all negative one, the world is going to end. Believe that self or world does not exist. For this, aurum mate is a beautiful remedy which is having marked despair and self-annihilation. Referential delusion, belief that neutral events refer personally to oneself. Among that, lachesis, which always misinterprets the things, and stramonium, which is having fearful misreading of surroundings. Then there are certain rubrics for schizophrenia in the repertory. Among the certain rubrics, Murphy's repertory comes with schizophrenia, catatonia, hebephrenia. Hebephrenia is same as disorganized schizophrenia. Earlier it was called as hebephrenic schizophrenia. Now it is called as disorganized schizophrenia and paranoid schizophrenia. So you can refer these symptoms and you can again find the same remedies are seen in the repertory also, which we have already discussed in Matremedica for schizophrenia. Then we can come across certain rubrics in synthetic repertory too. Schizophrenia, catatonia, hebephrenic, and paranoid. And here comes the last part of this topic. Can homeopathy cure schizophrenia? So this is the most critical question and requires a very clear answer. Within the framework of modern evidence-based medicine, there is no scientific proof that homeopathy can cure schizophrenia. Because schizophrenia is a complex biological brain disorder that requires comprehensive medical management. While some proponents of homeopathy may use the word cure in their literature, this claim is not supported by clinical evidence. So homeopathy should never be considered a replacement for conventional treatment, which is essential for managing symptoms and preventing relapse. So in short, we can conclude that homeopathy can act as a complementary medicine for schizophrenia. You can take the help of other pathies or other therapies, but homeopathy definitely has its role in curing the disease. We should not use the word cure, in managing the symptoms of the patient and leading him or helping him to lead a pleasant life ahead. So with this note, I would like to stop here, and any questions, if there are welcome.
Is Dr. Saudi, it was really a very good session, and The thing is that homeopathy is an individualized system, as we all know that, but we can manage the cases with some excellent results also. But nobody can claim that it is a curable disease. Uh, but
Yes, sir.
but it does not mean that homeopathic doctors need complementary treatment. Of course, there are patients who are coming with allopathic treatment, and they can take homeopathy along with that. But after taking homeopathic medicine, we can gradually withdraw some of their medicine, and one by one, and at last they can continue with the homeopathy. This is a practical part of homeopathy. And
Yes, sir.
if the thing is that nobody is but the rule we are following is a wrong rule. That's the reason why we cannot claim that. But if you look at whether it be a particular disease, the same thing is happened with the COVID also. No, the officials posted like this, that nobody should claim that I have cured this or that. But if the thing is that we cannot move forward, because our philosophy itself is the highest ideal of cure is rapid, gentle, and permanent. So if it is not happening, then we cannot say that nobody is able to cure anything. So in this, but definitely homeopathy can cure in most of the diseases. We have cure, but it does not mean that cure depend one from one person to another. And it does not mean that a particular medicine give cure. That is a wrong concept as far as homeopathy. The homeopathic science is not well understood by the so-called modern people. That's the reason why they want clinical evidence, and not the clinical evidence. The proving is needed, the scientific research evidence. But all these scientific protocols are prepared by the so-called modern people, and we are following the same rule. That is the basic defect the homeopathy fraternity face around the world also. So the clinical evidence itself can be considered as a research evidence, because our philosophy is a never changing philosophy, and our science is also a never changing science. So there are objections to our some of the points. But anyway, you have done a wonderful job in that. And
Okay, thank you, sir.
actually, we will have the system, the purpose of this forum is to take homeopathy to every home. So at least one case need to be presented, giving more importance to that. That is the specific, whether you are able to treat a particular case, then you can present that case. That is the best thing. Otherwise, people will all the other things people get from YouTube and everything. And just if you search for schizophrenia, Google, they will get all these things. But instead, we should. I'm not uh, saying that you have done that, but you are made in a better way with the homeopathic scientific philosophy also. That's good. Congratulations, sir. And I'm inviting Dr. Bipu Prasad Pandey sir to say what of thanks to the session, sir. You can say a few comments and only time, just 2 minutes remaining.
Thank you, sir. Really, madam, Dr. Swati, madam, you have collected and compiled all the slides in nice manner, and as sir said, that schizophrenia is such a disease that is not curable, but in homeopathy we not treat the disease but the patient. So as a whole, when we treat the patient by a dynamic medicine, so it can be controlled, or what I am thinking, the regular routine work can be done by the patient if the medicine will be prescribed judiciously and rationally. So your presentation really, it is excellent, and the examples from different pictures what you have given, they are also excellent. So this type of knowledge is required to give proper example in proper time. So that is great. So what I am thinking, it would be more better if some cases, as sir said, it will be presented that how homeopathic deals with schizophrenia. So thank you very much, madam, from IFPH team. we are grateful that such eminent personality, they are sharing their knowledge and improving our fraternity. Again, with thanks, I hope that this type of cooperation we need in future also. Thank you very much.
Thank you, sir.
Thank you, Vibhu Prasad Panda sir, Dr. Swati Kulkarni madam, and those who attend the English session. Tomorrow, we will have a session from Dr. Saket Gupta, and with that, we come to the end of the day. Thank you all. Over to Dr. Mariama John to moderate the Malayalam session. And before that, Dr. Swati, you want to say anything?
No, nothing. Thank you, sir. And all your suggestions are highly welcome. I will all.
Thank you. Thank you.
Yeah.
You all. Good night.